Welcome. My name is Cindy Wright, and I'm a program manager at the Child Neurology Foundation. Today's talk is an ongoing series about going back to school for children with neurologic conditions. Today, we're talking about considerations to ensure diversity, equity, and inclusion for our families that have different challenges. And we are discussing it with our experts who, no one's an expert right now, as Lillian was just saying to us, but we're all doing the best we can with the information we have as of today, which we know tomorrow the news may be different. This is being recorded August 11th. And so today I'd like to welcome our speakers. We have Lillian Ansari, Tammy Sinkfield-Morey, and Shauna Sherman, and I will let them introduce themselves. Turn to you, Lillian.
Hi, everyone. So my name is Lillian Ansari. I am a parent to 2 children with neurological differences. I have an 11-year-old with tuberous sclerosis and epilepsy, and I have a 15-year-old with a history of seizures and a number of other special healthcare needs. I'm also a special needs advocate, supporting other families with children with special needs. And I'm going to turn it over to Tammy for introduction, please.
You're muted, Tammy.
Hi, my name is Tammy Sinkfield-Morey. I have my doctorate in transcultural nursing. I'm a nursing supervisor at Gillette Children's Specialty Healthcare, where I supervise nurses that care for kids with special needs across all spectrums. There I do a lot of work, and I nurture a lot of our consciousness in cultural inclusion, unconscious bias, and finding ways to be anti-racist in this crazy society we sometimes find ourselves navigating in. But I'm a huge advocate for ensuring that all of our kids get the needs and services they need in whatever capacity they need it in throughout our communities, our schools, and in our institutions. And I will also have my colleague, Shauna Sherman.
Hi, my name is Shauna Sherman. I'm finishing my master's degree in leadership and management in nursing. I have worked on Gillette's neurology unit for a little over 5 years now as a floor nurse caring for children with epilepsy and seizure disorders, also with other neurological conditions, traumatic brain injuries, and that sort. And I currently serve as the evening permanent charge nurse on the Gillette Children's neurology unit.
Thank you both. So I have some questions that if you would like to choose, who wants to answer this one? How do you think families can manage the changing needs during their changing needs during this pandemic, both academically and medically?
I think we'll try to tandem these questions, and I can start. Care coordination is going to be pertinent in this, and that's coordination with medical providers, coordination with school counselors, teachers, school nurses, coordination with community liaisons. It's going to be essential because the multi-complexity of the needs and trying to patch things together in this pandemic of COVID and anti-Blackness and anti-people of color is going to require our communities to reach out and support one another. So, I mean, we talk about care coordination primarily in the hospitals in regards to making sure that those interdisciplines are connected. But care coordination is going to have to expand well beyond the hospital needs and go into the community and educational needs. I like the idea of the pod partnerships that people have been talking about, but you have to have a very well coordinated community with high capacity for all needs. So that's an option depending on the community that the kids with special needs are living in. And I think another thing for me also is that patience and forgiveness is a must during these times. We're going to have to be mindful of transgressions and move forward, have conversations that we can be respectful and supportive of each other in efforts for our kids to get what they need, especially as we continue to navigate through COVID at this time. And then families are going to have to be able to raise awareness about their challenges. I know in the past, oftentimes a family member's voice is stifled, especially when it comes to education and school needs and all of the policies and practices that schools are guided by. But this is a time where families are going to have to really speak up loud, and often go to their school boards or district administrators or building administrators or case managers, and then make sure that their kids' IEPs are in check and are ready to go, and they're thorough and they're detailed, as well as any 504 planning that they may have for those that don't have IEP. So there's a lot of things that we can do as advocates, and that parents can do as advocates, which is going to change from time to time. But to manage both the educational and medical needs, it's going to require that broad view of coming together for our kids. Shauna, you want to add anything to that?
Yeah, I think just one major thing, like you said, forgiveness and caring and compassion as far as being flexible, and not only the schools finding creative ways to support these children, but also care providers finding creative ways instead of, they're going to have to find more options as far as telehealth. Like, let's get these providers together, and these kids, who have multiple providers, have their appointments coordinated at the same time, so that these providers see them and they get the proper care that they need, so that they can go on, learning and being educated, as well as, managing their complex medical conditions or neurological conditions that they may have. So I think compassion and flexibility are huge.
One more thing I think too that has come up in the time of COVID is that the broad width of virtual care. I mean, before it was hard to imagine the need of caring for someone, assessing their needs, and being able to implement interventions and therapeutics that would provide for the necessary outcomes. But now that we're using virtual care for everything, I don't know why even providers can't start having virtual care conferences for our kids, or virtual care conferences with teachers and clinicians and parents, for the best outcomes for these kids. We're learning to use this as we are an example of today, for very targeted purposes and very specific purposes. And we can also start to use those specific purposes, including other team members in it. So I think virtual care is going to be huge for that. It's just making sure that the bandwidth is there throughout the communities for those that are particularly underserved.
Definitely, we're learning a lot of new ways to serve families, aren't we? So what do you think are best practices for medication or treatment compliances during the pandemic?
I think I could kind of start on that. I think one thing Tammy and I have been identifying just in working together is that there's a huge cultural barrier with healing, and then also with Western medicine, where we may not always, providers may not always feel that their patients are so-called compliant, I guess, with medications or with treatments, but it's not necessarily a compliance issue. It's more of, as healthcare providers, understanding that we can integrate their cultural healing methods with our medicinal medicines and Western medicines, and find a way to connect with these families, so that, compliance is not an issue, or that they understand that, hey, I can utilize these practices with my practices. But in order to create that bond, we as providers have to create a connection with these families and these different cultures, And doing that can be difficult when there's language barriers or socioeconomic barriers, because it's an issue more of trust than, you know, of learning what these people are needing and how we can best manage their care needs and be respectful of the cultures that we are dealing with as well.
In addition to that, I also think we have to be mindful with those concepts of compliancy and adherence. I did an article on the thought of the labeling of patients as non-compliant. So I choose not to use that term, primarily because we don't know the stories or all the underlying circumstances of why someone may not be able to take their medication, really is what compliance is, as compared to not having access or being able to refill or obtain their medication, which is often the case as to why someone doesn't find those regimens. So I think as we're looking at these best practices, it's important that we have a broader overview of adherence versus compliance, that we're also understanding what these risks of medication might pose for families or the kids. You know, does it potentiate or does it hinder the disease progression and complication? Is there more liability with it and being in the hospital because of some contraindication that might come with it? Are there medical expenses? We also need to look at the causes of them. And then in those causes, as Shauna pointed out, what are some of the cultural and historical components that prohibits the compliance as compared to adherence? And then we really need to start troubleshooting and having think tanks about how can we improve these processes of medication administration, the compliancy, as we're calling it, and the adherence of it. How can we improve this process so it is more culturally relevant and we can include more cultural ways in helping our families help their children to support these regimens and recommendations from their providers? I know some other things that Shauna had identified in our conversation was, you know, the simple practices of keeping a schedule, using a 3-ring binder or notebook to keep track of these, you know, setting alarms on personal devices, the iPads and all this technology we have around us. You know, make sure we have thorough and updated medication schedules to the school nurse, and make sure things are always written down, and that parents, it's important that parents review these medications regularly. I can't begin to count the times that a friend of mine who's a school nurse said that the parents will drop off a medication list at the beginning of the school year and they never come and update it until the next school year. And again, a big thing are finances. We have to be very, and I say we as community members, as teachers, as nurses, as practitioners, have to really be very aware of the financial constraints that many of these meds cause for some of these families. For those that have and don't have Medicare, are they sacrificing something to get a child's med, sacrificing something for the entire family? Or are they just not able to? So the key is finding ways to really connect with these families so we know their stories, we know their challenges, we know the conflicts they have in medication and medical treatment adherence, especially now during the pandemic when so many families have lost their jobs and can't afford their basic needs. And even are being evicted. So all of those things, I think it's up to us as community to really take notice of and be mindful of.
That, and even as healthcare providers, pointing families in the right direction if they don't know what resources that they can apply for or that we have available, you know, for assistance, or even as a provider knowing medication A is this amount of money versus medication B, which is just as effective, but maybe they can afford or is more affordable for these families so that they can stay on these meds that they need to manage their neurology conditions.
Or what's covered by insurance and what's not, and tweaking things so that they are. Very good, thank you. So during this time when there are varying learning environments, how do you think, what do you feel about the learning and self-care practices for youth with neurological conditions while things are continuing to change?
I can kind of start on that one. I mean, first and foremost, just for anybody's health, along with children with neurology deficits, a good night's sleep and practicing good self-care habits with these children is vital to their learning, their growth and development, and just balancing life in general. But then also as parents or as a community or as a provider, knowing, you know, what the stressors that youth have and identifying, you know, stress trigger points. And once those are identified, finding ways for those children to cope in a healthier way instead of, you know, through, let's say, anger or overeating, undereating, you know, depression, stuff like that, finding alternative methods such as being active or reading and pointing them in the right direction. And then also just reassurance. We kind of have we definitely live in uncertain times right now, and it can be very discouraging. And, you know, children need hope. And that hope that we can provide for them is, you know, just letting them know that this will end. It might not look the same, but we're gonna rebuild and we're gonna come back and everything is gonna be okay. And ultimately, I think as long as children know that, then they feel supported and they can, you know, practice good self-care, get a good night's sleep instead of worrying about, oh my gosh, tomorrow do I have to go to school? Are we going to have school? You know, and just creating a platform for them to kind of, you know, build on that hope and learn healthy alternatives to, you know, anxiety and stress and everything that everyone else is dealing with right now.
Yeah, I think I'm sorry, in our families, the parents staying regulated and self-care is honestly number one. I use the analogy of, you know, when you're on a flight, you look to, if something happens and there's a questionable noise, you look to the flight attendants. And if the flight attendants look panicked, then the passengers panic. But if they're calm, you think everything is okay. In this instance, in this situation, the parents and the caregivers are like the flight attendants. And I really think that we have to work on self-care and self-regulation first. And for a lot of our kids, co-regulation really is the most effective, right? So in my opinion, parents and caregivers, self-care honestly has to come first, right?
That's exactly it too. And that's what I was going to say. A couple other things. One is that co-regulation or role modeling. A lot of what the kids see comes from what the parents display and show. So having those opportunities for role modeling that kids, especially now when emotions are high and there's so much uncertainty, our kids are looking towards the parents and those respected community members to get cues from them, to feel their vibes and their rhythms, to see, to know what their spirits and their energies are giving off. So in helping our kids learn to self-care and manage their own spirits, they're really looking to us to see what we're doing for ours. There were a few other things that came up, like task analysis, you know, breaking down any given tasks that we're going to be expecting the kids to do on their own, breaking those down into component parts, you know, like something as simple as brushing teeth to, you know, maintaining hygiene at school. So breaking those down and working with our kids in parts to be able to do that. Creating a visual guide. And again, in that visual guide, it comes in many forms, including role modeling. So there's some nice visual guide creations on the internet that parents can find too. And then those ideas of prompting and fading, you know, enhancing learning opportunities through interaction, again, with parenting, until that child feels comfortable and the parent can withdraw or fade away from some of those teaching and guidances. And of course, peer support. We all do well when we feel that we have that peer support, whether we're adults and as parents, we can talk to other parents, or, kids when they're growing up, they're always relying on their friends and peers for extra guidance. So making sure that we have positivity in all of those various groups for the kids is going to be huge in creating those learning and self-care practices for them.
I agree. Very good. Thank you. So in your opinion, should schools consider special education services essential and have the special ed kids go back to school even when other kids are still sheltering in place and staying out of school?
I know for me, in answering this question, in my opinion, I can't one way or the other, because it's going to be dependent on the capacity of each individual family, in each individual community, in each individual school, to determine if they have enough support and resources to meet the needs at home or at school. So that's a really tough one. I do see, however, there's a lot of opportunities in this particular realm, in the communities, a lot of opportunities for these pod partnerships. So if you have a strong community and there's a wealth of knowledge about some of the issues with special needs, the issues of that particular special need for that child in that community partnership is going to be great. And school partnership can also be well, as long as all those other things are in place. If it's in a community where English is a second language, parents don't have the capacity to teach their kids at home, and then they don't have the resources, as we see with a lot of our kids that come to Gillette, they don't have those resources in the community to help them support their child's needs, then that particular community, school, or some type of external placement and for teaching and learning and care provision is going to be necessary for that family. So I think in those particular situations, they're going to have to start looking for resources that they can work with when they don't have the capacity to do it alone in their homes. That might even be looking at some of these rec centers, or finding ways to incorporate furloughed people, whether they're nurses or PCAs or teachers, or using retired teachers to create their own communities. So people are going to have to be really, really creative, because I can't answer it one way or the other.
Yeah,
it's going to be so dependent on what their community capacity looks like to be able to support the needs in school or at home.
I agree, and I think it needs to be really individualized, right? There are so many families that have other, like you said, they are not able to support their children. They have other kids. They don't have the technology access, right? Or they have to go to work. So I agree. Shauna, do you have any thoughts on that?
I think, a large part of that is also, where are we dealing? Are we dealing with an urban poor community that may not have the resources, or are we dealing with, a suburban community where, the median income is 6 figures? So I think that is going to be where the creativity comes into part. And I don't necessarily know right now if these children should be back at school, because I don't think schools are well prepared with, especially in the poorer communities. They don't necessarily have the capacity to social distance or to create these pods. And like Tammy was touching on, we have to find creative ways as parents and providers and as a community to find other ways that, okay, how can this Hmong family whose parents, grandparents, aunts, uncles all live in this single household, but they all support the family. So they're working and they're not able to, assist their children with learning because English may not be their second language. So how, as a Hmong community, or as, providers can meet into these communities and create these connections so that they have the support that they need to be successful, whether it's distance learning at a community center with, social distancing and separate days or, different times, or if it's, at a person's home with their children and utilizing, furloughed employees, or even, employees from the school who are comfortable taking on these opportunities to provide an education for families that might not, because right now we don't know who's going to school and who's not. And, as even with the neurology conditions that some children have, they also have other health disparities that put them at a higher risk, with respiratory issues, or, just if they're immunocompromised and now they're going into these school settings that might not have the proper PPE and the hand washing. And we have to face it. Children, we tell them social distance, but they want to be with their peers and they want to communicate and they want to, be normal. And I just don't know if that's a safe option, other than, finding better ways that maybe we can provide education and services for them.
And I think
Yeah,
one thing
and for
to state was that PPE, having access to better PPE, testing and tracing in the event that we are sending kids back to school or that we are doing more communal types of education and care provision. Having access to the PPE testing and tracing is going to be paramount in keeping our kids safe.
And then for kids like my daughter, who has a significant developmental delay, she can have access to PPE, but she's not gonna keep it on all day. And she takes chemo drugs. She's very immune compromised. It's really difficult. Honestly, for a lot of our families, we are special needs families. We're in some ways more equipped to handle this crisis because we're used to changing expectations and adjusting our expectations. And this is kind of next level for a lot of us, but it's we're a lot of times we're in survival mode and kind of having to be creative and plan as we go. And but for, like I said, for someone like my daughter, she just is probably going to be the last group of kids, among the last group of kids to go back to school because of all the other things she's got going on. So kids like both my children also get transportation to school. And that's another question. How is transportation once the kids do go back to school, but the virus hasn't gone away? What are safe transportation options for kids, for families that can't drive their own children to school, that usually take the bus or ride share with other kids? In your opinion, or what are your thoughts on what safe transportation options can be for our kids?
I don't have a lot of background on safe transportation, but I did do home care, and this was many years ago. So I don't know if they still allow CAC waivers to pay for transportation services, but I know that was an option that one of my families used, again, like I said, many, many, many years ago. So if waivers or access to grant and funding sources for kids with special needs that have IEPs or 504s or have demonstrated the need for them, using different waiver sources and securing transportation, if that's an option, provided that they have a caregiver to accompany them. I guess, I'm thinking a lot of these bus companies and educational transport providers are going to have a lot of available a lot of available resources by way of buses, since some schools are going to be doing, so that we're not going to be using the full threshold of services that they offer. So they might be willing to compromise or to contract for alternative transportation. So if there's waivers or grants out there to do that, that might be an option. Shared commuting, again, you're going to have to trust the person that's driving your child, but if there's some communities where, families are close and they're willing to do ride sharing or shared commuting, that might be an option. But there's a lot of liability issues in this, and there's always going to be that need to have another adult that will be responsible for carrying the child during the transport, because the driver's not going to be one to do that. If a child has a seizure or some other medical need comes up, there's going to have somebody there to accompany them. Other than that, I'm not well versed in that.
Mm-hmm. Yeah, the transportation issue is very complicated. For our daughter, I think we will have to ask for a consistent driver and no other kids in the car, or at least only one other kid that's consistent in the car. But you're right, that's a really complication. They get complicated, and it's really based on each individual's related services on their IEP or their needs. And in our community, we also have a lot of families and kids that depend on the school lunches and meals. And some of the kids, realistically, that's the only hot meal they usually get during the week, during the day. What do you think could be some of the ways, in your opinion, for the kids to have access to meals while we are sheltering in place?
I've kind of actually been witnessing this all summer with some of our patients coming in a little malnourished and not getting those lunches that they were getting at the schools, or the breakfasts that they had before school. And I know here in Minnesota, I'm not sure about other states, but I know we've got an abundance of food shelves available for families. I know that the schools, there's I think over 400 school districts that are providing meals to school-aged children, as well as not just the child, but also the family. And they're located all over the state. There's several websites that, that are provided. There's also, we have supplement nutrition assistant program that families can apply for if they've been furloughed, or if their income is below a certain level, then they qualify for electronic benefits transfer, which is kind of like a debit card that they can use for food and nourishment. There's also, Tammy and I had kind of talked about these furloughed, or not furloughed, but the employees, cafeteria workers at the school. Is there some way that, okay, now these kids are at home and they might be doing distance learning, but is there some way to get these meals prepared, and then, some sort of contactless delivery or drive-through where they just hand the meals out to the families, as they go through their school days. So that's kind of what I had with that, just knowing the resources, or as a school district, providing families with those resources so that they know what's available, especially if there's limited access to technology, and they might not know that they have these options, but just making sure that families know that there is help. They just need to maybe be pointed in the right direction to find that help.
And we did have just a beautiful and a robust conversation and discussion about this. But you take a district, for example, that doesn't have have students returning, and you still have these employees that are willing and wanting to work. You still have food resources coming in. You still have transportation available. So why not continue to make these lunches or these meals, put them together, package them, use the same bus system that you've already contracted the season for, reroute some of the time use of it, and get these meals together, get some of these employees that are working on this bus and distributing them at these various routes that they would be going to, or homes that they would be going to anyway. So again, it's going to require a lot of creativity and innovation, but we still have some of these resources available. It's just how we reorient them and redesign them to use them to meet the needs of the community and the kids of these districts.
That's a great idea, Tammy. I think that would be wonderful if they do that. A lot of people don't know about the districts distributing meals, or they can't get to the schools during the times that meals are being distributed. Some of the families are also talking about social or learning pods Do you think this is a safe or realistic option for kids with neurological conditions?
We've tapped on that a little bit, or throughout, I think, discussion about social or learning pods. And again, it's going to rely on the capacity of that family's resource individually and that community to support them. It's going to rely on the capacity of that family financially, and then having a strong enough knowledge base about that child being educated so that they can educate others. I think they're a great idea, and I think there's a lot of merit in them when you have resources that are cohesive, collective, and are willing to have those rotating parts where everybody has input and care and obligation. I think, though, for those communities that, like, for example, we got a dad in with his child for some services at Gillette, and dad had to bring the older brother. And during this time of COVID, we're not allowing any siblings under 18 in the facility. So we had to find a way that we could still provide the care for that child, yet maintain the safety of that older child that dad had to bring, because he said, I'm a single dad and I have no resources. There's no one in my community that is willing to help me care for this child so I can bring my child with special needs to the hospital or to the clinic. So we have a situation there where this man has no other resources. So in those circumstances, those families are going to find podding, whether it's social or learning pods, to be supportive or advantageous to them. But you have some other communities that have a plethora of resources and access and knowledge and education, by which they're going to be able to create some really strong supportive pods for family to provide respite care, especially in those circumstances where kids don't go back to school, because we haven't even touched on that. School has been a huge resource for many families, emotional resource for parents and caregivers to have opportunities just to have a moment of self-care for them without having to worry about care of their child. So when we get in these situations where these families that are accustomed to sending their child to school don't have that availability for that, we're going to have to find ways to support this support that family for respite care and other needs. And again, I think this is where that podding comes in, but that capacity has to be in that community. And those pods are going to also have to be mixed level pods where students that have lesser special needs can be supportive of the students that have more when they're able to.
For a lot of us with children with special needs, it could be very isolating to begin with, to have a child with special needs. And we worked very hard over the years to build a community and to support each other. And now all of a sudden it's gone, and it's pretty difficult. But do you think that the school districts should be able to assist families in forming some kind of a educational pod for their kids? Or do you think the families are capable of doing something like that on their own?
I really do. I think the onus is on the schools to provide that, because especially again when we're going back to the IEPs and the 504s, that money has already been allocated for that. So I think the schools are obligated to support families that can't get their kids to school with those fundings that have been provided to them for those needs, to help find ways to establish some of these safe podding communities or safe learning communities, whether it's, grouping teachers, nurses, school counselors, and a PCA. And again, finding a rec center or a big space. Again, because there's a lot of them now that we're not utilizing, that they can group kids together. I mean, again, it's just about thinking of creative ways to use all of the resources that we already have on hand to reorganize or redesign them so that we can meet the needs of these kids that are depending on us to be resourceful for them and their families that need our support to be able to provide the care to their children.
I agree with Tammy. Those funds, for the IEPs and the 504s have been allocated. Utilize those personnel to, come up with creative ways for these social pods to be effective, whether it's, okay, we've got a pod, we're going to use this community center, this community center, this community center, then we're going to have this amount of people, we're going to have the different levels, and then even using virtual. If the teacher doesn't feel safe, or the person, with the IEP, they don't feel safe being in person, projecting maybe virtually to these different pods, and they're in separate, areas, so they're maintaining social distancing, and utilizing it in that way, with, people on hand to offer assistance, whether it's parents or, PCAs or, the school nurses or other individuals, just to kind of supervise and to kind of help these children learn, but in a safe way, especially for children, who are immunocompromised, a little bit more healthcare needs than those that may not, because families may feel safer if they've got healthy children that, don't have any neurology needs, don't have immunocompromised, don't have respiratory needs, may feel more safe than, children with families who do have those special needs. So I think it's just finding creative ways. And I feel it's the school's responsibility. I think they should, the communities should take a little bit responsibility as well, just to find creative ways for the schools to educate their children.
Mm-hmm.
Yeah.
And Cindy, maybe you could speak a little bit about Child Neurology Foundation's article coming out about getting more in-depth into options for children.
Yeah, so each
Learning.
week we're releasing our video, and we also have an article. So we've had an articles about safe social distancing. We get a little bit about busing in that article. We have an article about what you can ask for in an IEP. There's no laws out there yet around this, but there is compensatory services. Like everyone said, the districts are, they have funds to support families, and so maybe they need to get creative about how they're using them. So we have an article about that, but this week we're also releasing an article about what these learning pods are. I think there's some people looking at homeschooling, some people are looking at distance learning, some people are looking at going in a hybrid back to school cohort situation. There's learning pods, and there's also care pods, where it's not about education, but it's just about a place for these kids to go while their parents are working. So there's a lot out there. It's really going to vary by where you are. And I think for families who don't have the resources and maybe even aren't able to watch this today, I think for people who are, reach out to your school and see what you can do to help those families, or if you know families in need, reach out, because they might not want to ask and they really need the help. So, and I think that's all we have time for today. I just want to thank all of you for joining. I learned a lot. I definitely, while we do a lot to support my kids and their needs, I kind of want to go do more for others. So I hope others get inspired and that we can get all these kids what they need. And we will have this video and more information on our website at childneurologyfoundation.org/COVID-19. This is the Back to School series, but we have a lot of other content like lost services and therapies, some solutions for that as well. So together we will get through this, and together we are all child neurology. Thank you.